So, Jacob from Ohio, how are you? And do you
Hello, I'm
have
doing good.
yeah, so your statement is there should be no health care for trans children. So, let's have the conversation. So,
Okay,
why shouldn't there be health care for trans children?
I just want to say thank you for letting me have this conversation. I appreciate you taking the call.
Yeah,
Um,
absolutely.
so this is some personal experience of mine, and we can get into that if we get into it. But to me, that time of life is for experimentation, right? That's the time that you experiment with new clothes, with makeup, or with makeup in both directions, right? I know, I'm 38. I've got a teen who's non-binary. They've got friends that are, both sides of the transgender spectrum. Some of them use makeup to look like a boy. Some of them use makeup to look like a woman. And to me, that's the time for experimentation. That's when you experiment to see you which one would fit. That's not the time to go all out medically and go put virtually put all your eggs in one basket and go that route.
Sure.
And
So,
so,
Jacob, yeah, do you mind if I jump in really quick?
go ahead. Go ahead.
Yeah. So, I think that this is a good conversation to start with here because I would say that everybody grows up in different speeds, right? Like some people are, really into something, and then different people come into different thoughts at a different points in time. And so what we try to look at here, right, is sometimes it's more than experimentation. For some people, it is experimentation, and people are living their lives. Like if they're non-binary, they're playing around with different expressions or anything like that, and that is just how they're living their lives. But for some people, it's not so much experimentation than an actual understanding, right? And so this is why I think the healthcare portion, like especially psychological, adolescence healthcare, is incredibly important, because there's a lot of children, and I would say minors that are young, that are very clearly trans, right? And what I mean by that is there is observable, like, okay, this is what they prefer. They prefer to do dresses, dolls, whatever. And then at that point, you go and you get a medical evaluation from a pediatric psychologist. And that pediatric psychologist then observes that child for several years. Now, I'm talking about a kid that's like 6 years old, 7 years old, right? That the pediatric psychologist then observes that child to look for gender dysphoria. And what that gender dysphoria has to be is consistent, insistent, and persistent, meaning that they have to have those really rigid categories of them saying, I'm a girl, I'm a girl, I'm a boy, I'm a boy. Like that's just how the psychiatrist is connecting with that. And then after years of evaluation is when those conversations are being had with the doctor and the parent and the patient about trying to pause the puberty of that child. And pausing puberty is completely healthy, it's completely normal. It was created for cis kids that were starting puberty too soon. So many people have grown up, have children when they had puberty blockers and when they got off of them. And then after a few more years on puberty blockers, that's when the conversation with the doctor is being had about having the cross sex hormones, right? Where it's like, okay, the child, the doctor, and the family member is making the decision for the best interest of the patient to say, this is the puberty that they're going to go through, right? Is it going to be the puberty that is assigned at birth? Or is it the puberty that is natal, right? the way that they were born, right? So after all of that evaluation is before any type of medical interventions are typically done for the youngest of the trans kids. Most of the times for teenagers, though, by the time they're starting to understand, it takes about a year of evaluation and then they can start. But a lot of times they've already started puberty, and then you're more in that experimental phase, and sometimes it takes a little longer. And usually people either start at 16 or maybe 17, or possibly just wait until they're 18. So that's what the healthcare that I believe is necessary, because it's doctor prescribed and doctor evaluated. Does that make sense, Jacob? I'm sorry I kind of went on a long diatribe there, but I just wanted you to like understand what trans healthcare is so we can start there.
Yeah, that makes sense. I mean, from my personal experience, I've had a few family members, that turned out to be gay, and when they were, 6, 7, and 8, they basically expressed as feminine for essentially up until 16, 17, and depending on the climate, of the, I guess, the zeitgeist that's in the public persona, him just expressing himself in characteristically feminine ways could lead him to believe that, oh, I'm not really gay. I should be a woman because I'm expressing female characteristics. And I've also had experience. Also, sorry, go ahead. You want to add something?
But yeah, I just want to say there's a difference of like expressing femininity versus saying I am a girl, right? So if you're the gay, family member, who is a boy, is expressing feminine characteristics but never is outright saying I'm a girl, I want to be a girl, those things come naturally to the actual person if they're trans, right? Nobody is like turned trans, if that makes sense, right?
Yeah, we don't see a little boy who's into musical theater and say, we need to trans this one. Like, that's not how it works.
Yeah.
No, but I've also seen two of my I call her. It's hard to not call her my daughter because she's been my daughter for so long, but I call her my daughter for the sake of getting confused right now. So my daughter's had two friends, and they've went from expressing themselves as trans to deciding that they're not trans in the span of 3 years. And somebody that was trans told me, well, they were never trans. And that kind of confused me because I thought the definition of trans was if you identify as the opposite sex. And according to them, that's what they're experiencing for 3 years. And, and there's also the act of rebellion too. Kids rebel, right? So, just like rebellion's always been cool. So that's an avenue for kids to take in terms of a rebellion. I know it seems a little extreme, but rebellion is often extreme. And my main point is just that childhood is not really the time or the place to take those extreme measures. That would be in adulthood. We all know the cerebral cortex doesn't develop till you're 25. And it's also kind of flipping the whole notion of consent on its head. Typically throughout the entirety of society, we have let the adults consent. And now,
well, I want to jump in, Jacob. I'm sorry, you've put a lot out there, and I just want to make sure that we can address all of it so that we don't miss anything.
Go ahead. Go ahead.
So children consent to medical procedures. It's kind of a required part of the process. Like doctors confirm with the child, like, what's going to happen, right? And make sure that they know. Like, minors can make the decision of like, yes, I did just blow out my knee in football practice, and I'm going to get a surgery that has a much higher regret rate than any transgender procedure. So the consent thing, like, children are involved in the process of consent. An ear piercer won't pierce the ear of a child who is clearly not okay with it, even if the parent is dead set on getting the kid's ear pierced. Like, yes, for many major decisions, like signing $100,000 loan for college and things like that. Yeah, we do tend to wait until the age of majority, but overwhelmingly, for medical things, children are involved in the process. And I also want to kind of push back on this portrayal of seeking medical care as extreme. It's like, is therapy extreme? Like, if a kid feels that they have gender dysphoria, is taking them to a therapist extreme? Because that's a form of healthcare for trans youth. Is pausing puberty to give them more time to think about it extreme, knowing that that does not have any permanent effects on them? Even like it doesn't have any permanent effects on a precocious puberty cisgender kid. So why do we feel that that is an extreme measure when the point is to give them time to think about it?
Well, how long have puberty blockers been used for?
Since
well, they've
like
been
the
used
70s.
Yeah, so
Like
they've been used for
70s.
precocious puberty and trans kids since at least like the 70s and 80s. So both for early puberty and for the purposes of like transition care, there's like at least 50 years of knowledge and data about that. And it basically is just like, yes, they shouldn't be on them indefinitely. We want to make sure that we use that. Let's just say 2 years is a good benchmark. We use that 2 years to let them experiment without all of the stress involved of their bodies changing in a way that they might not be okay with. Because let's be real, puberty and some of the effects of puberty are irreversible. So, you know, if there's concern about the irreversible impact of hormone treatment, then we have to acknowledge that there is a permanence to a lot of the things that you go through during your natal puberty. And the point of seeking this care at a younger age is to give them that extra couple of years of buffer without, like, it can be very intensely stressful to have your body changing in a way that you're not okay with. Like, I know that it's really hard to get as somebody who hasn't experienced that, but it's more than just being like, oh, I started my period and I don't like it. Like, okay, yeah, that's a pretty common experience, but the level of distress that some teens experience, it's like, they can't even functionally experiment if they're going through that. So the point of this healthcare is psychological evaluation, like Josie was saying earlier, and the pausing medication that gives them extra time to consider. And then, if it is true that they are insistent, consistent, and persistent since before puberty a lot of the time, then it's appropriate, I think, to allow them to transition into puberty at the same time as the rest of their peers. Like, I personally think it's uncool to make someone wait until they're 17 or 18 to start cross-sex hormones, because
especially
by then, when they know, by then they've had like literally multiple doctors, endocrinologists, psychiatrists, like multiple professionals and parents. And in a lot of places, both parents have to sign off. Like, even in California, as of a few years ago, you needed both parents to sign off. So I'm just not really understanding what is so extreme about, you know, allowing young people to make decisions about their entire future. Like, when we're okay with them, like, again, joining the ROTC, which you can do at age 16 and 17. And then signing loans for college at 18. You know, what's the difference between a 17-year-old and an 18-year-old functionally?
Well, you could get, I mean, you can get over the debt if you're, you know, and part of this is the detransitioners too, right?
Sure.
Yeah, so like 2%
and
of trans people detransition. So like 2% of all the people who transition regret it and detransition. And then also like the majority of people who detransition do it because of social stigma, and they retransition later when they're in an affirming environment. So there's like 10 detransitioners going across the country making hundreds of thousands of dollars a year. And it's not very honest.
So Jacob, like I get what you're saying. And first, I just want to say it, just to put a point on this piece, is like, this is all doctor prescribed healthcare, right? That's one thing, right? This is doctor prescribed healthcare that parents are consenting to, that the child or minor is consenting to at this point. And so before we jump on the detransitioners, because I definitely have a lot to say about that, do you agree that when a doctor, and all of the things that we talked about, like the psychological evaluation over time, the years of time that it takes, the amount of the amount of doctor support is necessary, the consent of the parents and the consent of the minor to do these procedures, do you think that that's reasonable?
I believe that ultimately the pharmaceutical industry, when you're talking about stuff like this, is driven by money.
But this isn't pharmaceuticals we're talking about. We're talking about your family doctor, right? We're talking about the doctor that you have trusted, that you are going to, that you has been with you for years, every step of the way. I'm not talking about going to big pharma to get your medicine. I'm talking about a doctor with the prescription book that you've trusted for your life, for your family. Like at that point, it's like, if you don't trust any doctors, then, right? So you don't go to doctors because they have prescribed.
No, the two children I'm talking about that detransitioned, their family physician wouldn't touch it, and they sent them to somebody else.
Well, there we go. Talk about the detransition. So let's say it is the family doctor, and it is all of those things. Would you say that this is reasonable treatment for most cases? Like, let's talk about 99% of cases. Would you say that this is a reasonable healthcare procedure by the way that we've explained it so far?
If it's a family doctor, I would err on the abundance of caution, and I let them wait till they're 18.
Well, I mean, if the doctor is prescribing it, though, like, I'm trying to talk about, like, because the statement there should be no health care for trans children sounds like a policy, right? So the question is about you, Jacob, saying, okay, I want to make this way, is a very different question to making all families that agree with this position should be able to have this option, right?
Can I clarify a little bit on my position?
Yeah, go ahead.
Okay, so when I say no healthcare should be provided to transgender children, what I mean is like medical intervention, therapy, changing clothes, doing things outside of the scope of medication or surgery is what I'm talking about. So anything.
So part of what Josie's trying to say is that the doctors themselves err on the side of caution. Like, the whole medical system agrees with you, Jacob, that you should err on the side of caution, which is why it's a multidisciplinary field, the treatment of trans children. So usually it's not just your family doctor. They also see like at least one therapist, and they also see an endocrinologist, right? Like there are blood tests and years of therapy involved here. So for those doctors who are
right.
Well, yeah, because there's no brain scan. It's self-reporting is what he said. Yeah.
Oh, yeah,
It is self-reporting, but like that's how we diagnose every single mental phenomenon. Like when you have depression or anxiety, or if you have schizophrenia, like there's no blood test that can show those things. So yeah, it's self-reporting. And it's like, if they spend a period of years saying, yes, this is who I am, this is how I feel, this is what I want, the doctors are basically, the bar is incredibly high for you to get this care as a trans child anyway. Because yes, there are a bunch of cisgender doctors saying, but I'm not sure, let's give you another year, right? So the doctors are already erring on the side of caution. The doctors are already erring on the side of, we want to make sure nobody gets this care who doesn't need it, because the doctors don't want to get sued. You know, there are lawsuits right now of detransitioners suing their doctors, even when they were 32 years old when they got the procedure done. So yeah, like I think that it's interesting when lay people assert that they feel that their amount of caution is like better, that the default position is, oh, they can wait until they're 18, but that's too late for a lot of trans kids,
a lot of people.
Yeah, that's like, there are changes that they can't take away, and like a lot of psychological damage that they've incurred that they can't undo, that's irreversible, right? So, what is the answer to that? Like, why do we want to impose suffering on this group of people just in case someone might regret it? Like, just in case. Like, I just don't really get it.
I don't know why you would say that would induce suffering. Aren't the majority of trans people did not go through the hormone therapy? And
well, many of us don't have access to it, even though we really want it. That doesn't mean that we're just not getting it because we don't want it.
Yeah, that's true. And also a different, like, remember how we talked about, Jacob, that people discover things in their lives at different points in time. Some people discover, like myself, at 34 years old. Some people discover it when they're 20 years old. Some people discover it when they're 6. Right? There are different times that humans, in their understanding of themselves and their own gender identities, people figure it out, right? And most people are cis. Most people are just assigned the gender that they were born with, their sex, and boom, they move through life, and that's majority, 99% of the people, right? But there is a small segment of humans that isn't an easy answer. So because people decide at different points in time, there are different situations at different times on why this happens. So when you have a situation where somebody discovers that they're 6 or 7 or 8 years old, and you have these medical doctors, and it's a multidisciplinary thing, from psychology to family internal medicine to endocrinology, which are all very different profession disciplines, right? Those are all the things that are done. And then you have the family, the parents, as well as the minor that is like, yes, I want this. Why should the government intervene in that decision of doctor prescribed healthcare that a family has been intimately living with for years?
I would say because kids can't consent.
But that's your opinion. So do you think
that a footballer
right?
should not get surgery? Like, do you think that a kid who's gotten, like, do you think that kids cannot consent to getting, like, their ears pierced? Like, where is the line here?
Treatment?
It's in a whole different universe.
It's not really. It's about body autonomy. It's about their choices, about their life permanently. Do you think that kids should be able to consent to doing ballet because it permanently fucks up your bones? Like, kids who start ballet and gymnastics when they're young, they are permanently different. Like, doctors can look at you 40 years later and oh yeah, you were a dancer, huh? Like, why do you think that's fundamentally different in some way?
Because that has been all around shown to have positive benefits throughout.
So does trans care. Trans care has been shown positive benefits. But Jacob, let me just say this. The reason we bring up the football player, the kid with cancer, the appendicitis, person getting treatment for ADHD medications or depression, and trans care all in the same category, because it's all doctor prescribed. Do you understand? It's all doctor prescribed professional advice that doctors are giving to families. Evidence-based clinical care, right? So Jacob, that's why it's strange and weird to single out one thing that is trans care and say this one sliver, it's not okay in medicine, when the rest of the medical community disagrees and says, no, that is medicine and this is doctor prescribed. That's why I believe that we should, in this country, have the freedom to be able to listen to our doctors' professional clinical advice to provide the healthcare that we are prescribed. I think we get into dangerous territory when we have politicians come in and say, no, that procedure is allowed, but this procedure isn't, right? Because now we are messing with the profession, which is medicine. And we know from the clinician. Yeah, go ahead.
I was going to say, what do you say to the notion that they started doing this before that they had this multi-year data? they started doing.
They've been
these
doing this since the
transitions.
1920s, even more so since beginning of like we've had trans people in existence since the beginning of human civilization, right? It's not a new phenomenon for people to be trans. The fact of the matter is, guess what? I was a young person once as a trans person, right? Like I'm a trans woman, discovered it at 34 years old, but I used to be a young person, right? And so in reality, it's like when we have the human experience and we're able to discover through medicine and understanding of clinicians and all of this work that we realize that some people, like I said, Jacob, right? Some people figure out when they're 6 years old and some people figure out when they're 75, 82 years old, right? Like it's just a different journey that we all take as humans. So most people probably will discover it in their 20s. Some people will discover it when they're young. Some people will discover it when they're a teenager. And what we got to do is make sure that medical science and doctors are there to capture and help people when they come about, right? And that's the reality. We should have the freedom, families should have the freedom to seek medical care for their children when they seem to be distressed. And somebody who has gender dysphoria and is not getting treated is suffering a form of distress. I would be up in arms, and I'm sure you would be up in arms if somebody was like, you know what, this specific form of child cancer is should not, we shouldn't risk giving them chemotherapy. We should just let them live for cancer and frail until the age of 18 when their body can take it better. You would probably be like, what are you talking about? Like other kids have survived this.
Yeah.
Why are we having this discussion? Right? It would be very strange. Wouldn't you think that would be strange?
Yeah.
Yeah.
But that's
It's the same
that's a
thing
whole
with
different
trans
thing
care.
for me.
No, well, for you it's a different thing, but for medical doctors it's not, right? And the medical profession and medical clinicians, they all know that this is healthcare across the board. And to have politicians come in and say this is allowed and this isn't allowed is affecting the freedom of families to get the doctor prescribed healthcare that they should be free to be able to have.
Have you heard of the Cass report from the UK?
Yeah, it's been
Yeah,
widely discredited because it was made by
yeah,
specifically anti-trans people who refused to look at any data that counteracted their views. It's being
yeah,
widely
Jacob.
discredited. There are so many people who have gone over it in thorough detail.
What
Jacob,
about
I want you to
Sweden?
think about it. Sweden has their own their protocols as well. Jacob, it seems now that you're just kind of reaching, right? And right now,
I'm
I
going
think
on
it's
data.
best if we, and we have data too, and we show that with the W path and clinicians and the just the sheer satisfaction of trans people's lives, we are able to know that trans people do not normally regret it. And if we used regret as a form, we would stop doing nose jobs, we'd stop doing nose surgeries, we'd even stop doing heart surgeries because people who have cardiac surgery also regret it in a lot of cases too. In fact, trans regret rate is actually one of the lowest regret rates of any type of surgery in the world, that sitting at 1%, when on average surgeries across the board is about 20%. Right. So we have to look at the thing that helps the most amount of people. And right now, what we know is what helps the most amount of people is going through medical, clinical, prescribed healthcare by physicians that say this is helpful, and it's up to the parents and the patients to agree and consent to those things so then they can live their lives in an effective way. And it's tragic if some people go through the system and realize that they made a mistake, but overall 99% of those people are not saying that. So that's what we have to do as society in all medical care. Why make an exception just for trans care?
Do you know who Kristen Beck is?
Yeah, I'm a trans veteran too, right? And
Okay.
I'm completely fine. It doesn't matter like a Navy SEAL who decided to say, "Oh, I regret my transition." She was already an adult when she already served an entire illustrious Navy SEAL career and then decided to say I'm trans and then decided that she's not. That's an adult, right? We're not
No,
talking
no,
about that.
Yeah, but it's not that she was an adult. Is that whenever she came out as a transitioner, she was bullied. She got death threats, etc., etc. There's another one, McKinnon, Doctor
Yeah, that's why she
Kinnon,
detransitioned, though.
McKinnon.
She
Do what?
detransitioned
Do
because
what?
of the death threats. Then, right? Is that what you're saying?
No, no, she detransitioned and she tried to talk about it in the community, and she got death threats because of it. And that's why I believe that the
Well, I
rate is
don't condone death
1%.
threats. I don't condone death threats, and neither does most people in the trans community. I think a lot of people have a lot of sympathy for detransitioners because gender dysphoria sucks. And it sucks to live a body that isn't congruent with yourself. So if somebody is cis and then they transition and they're still cis, yeah, I feel sympathy for them because they're living with gender dysphoria. So a person who's detransition is living with gender dysphoria, and we want them to get the treatment to go back to something that makes them more comfortable in their bodies. I would say
But
that
yeah,
99% of the trans community agrees with that.
yeah, and my point was just that I don't believe it's 1% at all. I believe that it's much, much, much higher because they
Well,
get death
that's
threats and
incorrect, though.
ostracized from the
Do you
community.
think that,
And
hold
that,
on,
that was just my
like,
point.
first of all, Jacob, you're
I think it's
wrong.
probably 20.
The data
Uh,
shows overwhelmingly that trans people do not have regret when they get surgery, when they do hormones. We don't have a huge amount of regret. It's
Yeah.
like objectively the case. Do you
Yeah.
genuinely think that detrans people get more death threats than trans people? Do you genuinely think
Yeah.
that there is a stronger social stigma against being detrans than there is for being trans? Like, sometimes you just
no,
have to deal with the
um,
fact that things suck and like be yourself anyway. But we're having a meandering conversation here, and we're going to have to
Yeah.
reel it in pretty quickly because we
Yeah.
need to take a couple more calls before we wrap up. But
Yeah.
I encourage you to think about the things that we've said specifically about children and their right to access to healthcare. And you're more than welcome to call back later in the month. I know I'll be back later in
Yeah.
the month. But like,
I agree.
I want to try to keep things focused as much as possible in the future calls,
Yeah.
because
And we have spent a lot
we're
of
starting to
time
get
with
off
you,
the rails
Jacob.
here.
Yeah, but I appreciate your call, and I appreciate you letting this conversation be respectful. Just take a thought about families taking, doctor prescribed healthcare, and really deeply think about like personal freedoms and families' freedoms, and think about why we should allow doctors to produce that type of care and for people to consent to them. I think is probably a better conversation to think about for a while. But we really appreciate the call, and definitely call back later if we want to continue this conversation.
can I ask one
Okay?
question really quick, and that's it? The
You'll
one
be
question
very
was,
quick because I gotta go soon.
yeah,
But go ahead.
yeah, just one question. If somebody identifies as trans and then they detransition like later in 2 years, are they trans for that two-year period, or were they never trans?
I mean, it really doesn't matter so much, other than like at the time they were trans and then they weren't trans.
Okay.
Just
Okay.
it's like kind
Or
of
they
how it
thought
goes.
they
It's
were
like,
and then they weren't. I don't know. Yeah.
yeah,
Yeah.
exactly.
Okay.
It just is what it
That's
is
all I wanted to know.
sometimes. Yeah,
Okay. That's
absolutely.
the only question. Thank y'all for
Yeah,
being
okay.
polite. I
All right.
appreciate it.
Thank you,
Yeah,
Jacob.
thanks
We
to you.
appreciate
All
you.
right. All right.
Thanks.
Bye-bye.
Bye.
I hope that Jacob thinks about some of the conversations, and about
Calls
it's just
back.
about
Yeah.
freedom to access to care. It's just about freedom to access to care, and it is weird for like this specific segment of medicine being scrutinized at this level when other things in medicine are just completely ignored, right? Like it's just weird. I'm going to use that word. It's just weird.
Yep.
Hello, I'm Jimmy Snow, executive producer for The Line and avid candy eater. Hey, if you'd like to support this channel, you can do so now on Patreon or as a channel member with tiers specific to supporting specific shows and hosts. And it also supports our ability to expand programming going forward. You could also leave a super thanks down below, get a little special highlighted comment, and I'll tell you what, you could hit like and you could hit subscribe. Now, here are some video suggestions so we can fudge that algorithm. Go with one of ours. Forget everyone else on YouTube. I'm begging.